Welcome to Structural Anatomy online tutorial. In our first lesson, we're going to go through anatomical terminology. Now the skeleton is broken up into two sections. The first is the axial skeleton and the second is the appendicular skeleton. Now the word axial skeleton comes from the word axes, representing the central section of the skeleton. So it includes the skull, the vertebral column and the thoracic cage. Now the purpose of this, making up 80 bones, is largely around protection. So if we think of the skull protecting what's inside there, protects the brain. You've got the vertebral column protecting the spinal cord, and then you've got the thoracic cage protecting things in the thoracic region. A lot of important organs in there like ribs, heart, lungs, and so forth. On the other side you've got the appendicular skeleton. Now the appendicular skeleton comes from the word appendages. Appendages meaning limbs. So included in there is the upper limbs, the lower limbs, the shoulder girdles or pectoral girdles, and the pelvic girdle. Now, so this is basically saying the arms and the legs and the places where they attach. So when we look at the skeleton, we've got the skull, vertebral column and thoracic cage in the axial skeleton, so just this central cord coming from that word axes. Then the appendicular skeleton with the shoulder girdles and the upper limbs, and the pelvic girdles and our lower limbs. Altogether, 206 bones in the body, 80 in the axial skeleton and 126 in the appendicular skeleton. So in this next activity, you're asked to write down the names of the skeleton, all the bones in the skeleton. Right? So you'll notice here, there's a position to label them all. I want you to take a moment to have a go and see what you already know. Some of these you may know, some you may not. So some of you may have known some answers there from previous learning and other courses you might have done. Some of you may have no idea, and that's okay. We're going to go through each of these, the answers, and then how to tell them apart when they're used in isolation. So the first here we've got is the clavicle, also known as the collarbone. You've got the scapula, often referred to as the shoulder blade, the humerus, the radius, which is on the thumb side as you're in the anatomical position, the ulna, the carpals, the metacarpals, and the phalanges. The next we've got the coxal bone. Now this is a coxal bone. People often would think of it as maybe the pelvis or the pelvic girdle. There's a difference between the pelvis and the pelvic girdle, which we'll get to later on, but an individual name for that bone is the coxal bone. Then we've got the femur, the patella, the tibia, which is the bigger shin bone on the medial side of your leg, the fibula, and the tarsals, metatarsals, and phalanges. Now that you've had a go at that skeleton, many of you might have got a lot of them right. However, when I put a bone down like this, out of context and when it's taken away from the body, some people may not know what they're looking at here. So if I asked you a question, what bone is right here in front of you, what would you answer? If you answered humerus, you'd be correct. If you answered femur, you would be wrong. Now there's distinguishing features on this that tell us whether this is a humerus, a femur, or any other bone. And there's all these lumps and bumps and little nooks and crannies all over it that help us distinguish not only what the bone is, but if we're looking at the right or the left bone, if we're looking at the front or the back. So I'm going to go through each one from the top to help us distinguish which bone is which. So here we're looking at the clavicle. Now the clavicle is this sort of S-shaped bone. Now there's not a huge amount of distinguishing features on the clavicle, but you notice at this end here it's quite flat, looking at it like that, and this end here is quite sort of bulbous or round. So this end here is the medial end, this attaches to your sternum, and this end here is the lateral end, it attaches to your scapula. So you know the top from bottom, so that's the inside and out. You know the top from bottom because the top is quite smooth and the surface all looks the same. But if I flip it underneath, you'll notice there's this groove through here, there's a bit of a lump sticking up here. So we can tell our left from right very simply. So what do you think that is? If I'm looking at the top, and I know this is on the shoulder side, and the S faces forward at the shoulder side, this must be a left clavicle. It's left because I'm looking at the top, and it's going forward at the shoulder. Here we're looking at the scapula. Now the scapula, again, has a nice front and back. This is the front surface of the scapula. We see this nice smooth basin-like depression. On the other side of the scapula is the back. It's got this ridge that runs across the back. So it's very easy to tell front from back. So this is the front, it's nice and smooth, and then this ridge is across the back. Now this here, this socket, this is where your shoulder attaches. So the humerus comes in and attaches here, making a nice ball and socket joint. So I know this must be the lateral side, and this must be the medial side. So if I'm looking at the front, and I know this is the outside where my arm attaches, this must be the left scapula. Here we're looking at a humerus. Now I know it's the humerus because at one end it's got this ball structure, and remember there's only two ball and socket joints in the body. It's either going to be the humerus or the femur. If I looked at them both next to each other, you see the femur looks quite different to the humerus. It's got the neck and then the big, much more spherical ball on the end. It's also a lot bigger, and I look at the other end, the humerus, it's got this hourglass type structure. The femur, it's just got these big two condyles, these big round balls on each end. So looking next to each other, they actually look quite different. But if I focus in on the humerus here, so I know that this is the shoulder, so this is the proximal end. The hourglass forms part of the elbow, so I know this is the distal end. I also know I'm looking at the front, because when I flip it over, it's got this hole, this divot in the back, and that is where my elbow goes. So if I attach the ulna into there, it actually makes the elbow joint. So that's when I straighten my arm, that's where my elbow disappears into. So I know here I'm looking at the front of the humerus. I know this is the top, I know this is the bottom. And this is the front because this big hole here is on the back. Now I can also tell inside from out or medial from lateral because this here called the medial epicondyle of the humerus is much bigger than the lateral epicondyle of the humerus. So I'm looking at the front of the humerus. I know this is the medial side. This must be the left humerus. Now the ulna which we just saw, the ulna is got this really distinctive U for ulna. This forms by elbow. So I know this ulna, it's very easy to spot because of this U-type structure. It's harder to learn left from right. When I have my arm, I know that the ulna is on the pinky side of the arm. So it fits in on that side of the arm like that. So therefore I know the radius must always be on the lateral side. So if I placed a radius next to it, it would look like this. Now in this example I'm looking at my right arm. Now I know it's my right arm because I can see the elbow here, which must be at the back. So I'm looking at the front of the arm, and it's got this little groove right here. This is a very important structure because that is where the radius connects into. So this is why I know I must be looking at my right arm, because I know when I'm looking straight on, which I know because of the elbow, the radius has to be on the lateral side. It always has to be on that thumb side. So this is the right arm. I know this is the ulna because it's got the U. I know the back from the front because I can see my elbow. I know the left or medial and lateral because the radius is always on the lateral side. So this groove that we're looking for is always on the lateral side. Now with the radius, I know this is the radius because it's got this complete round spherical end here. This round half a radius, half a round if you like, is at the proximal end of my radius. It's got this really distinguished lump which is on the front, so I know I must be looking at the front. You'll notice when I turn it over, that lump does not appear. At the other end of the radius, it's got this point. This points towards the thumb. So not only is this entire bone on the thumb side of the forearm, but this little point here also points towards the thumb. So it would look like that. So it's on the thumb side, but also pointing towards the thumb. So I know this must be the right radius. It's the right because I'm looking at the front. I know this because it's got the lump on the front. And it's got this little process here pointing towards the thumb. So this is the right radius. So here we've got the hand. Now the hand has got three different sections of the hand. Here we've got the carpal bones. These are these really short bones in here, small in structure, all formulating the carpals. They're also known as the wrist bones. These 5 long bones here represent the metacarpals, finishing there, and then everything that extends beyond that are the phalanges. So phalange, 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 phalange. There's 14 phalanges in total, called proximal, middle, and distal. We'll go into more information in that in a later tutorial. So this is what we call a coxal bone. So it forms part of your pelvic girdle, but individually it's called a coxal bone. It's quite an irregular shaped bone, sometimes difficult to tell front from back or otherwise. So a couple of distinguishing features here. Number one, this rounded part here is what you sit on. This pointy part forms part of your pubis. So when I place it like that, I know I must be looking at the front because the pointy part's forward and the round part is at the back. This here is, if you put your hands on your hips, this is actually what you're putting your hands on. So the bone would be positioned like that. So point at the front, this is your hips. And this socket here, very important, this is where the femur would connect into. That socket making the ball and socket joint of your hip. So if I'm looking at this and I know here my femur is going to connect, I know my femur is going to connect in here, then I know that this is the lateral side and this is the medial side. I know I'm looking at the front because the pointy part is forward and the rounded part is at the back. This must mean I'm looking at my right coxal bone. So now we have the femur. Quite distinguishable because of this big spherical round head on the neck that forms that ball and socket joint at the hip. Now, I know I'm looking at my front of my femur because it's got this nice smooth surface right here. This is called the patellar surface. If I flipped over to the back, I can just see this big groove between these two condyles. So front from back at this end is quite easy. It's smooth and flat here where your patella would sit, and it's got this big groove here at the back. So the socket we know must face medially. It's connecting to your coxal bone. So this must be the medial side and this must be the lateral side. And we know here that this must be the front and this is the back. So if I'm looking at the front and this is the medial side, this must be my right femur. So this is a tibia. So tibia, this is when you feel like your shin. This is what you're running your finger down here is your shin. So this is a tibia. Now you notice the tibia, it's got sort of a bit of a curve to it behind here. This is the back and this is the front. It's got this kind of bulge on the front here. This is the bulge if you felt just below your knee. This is what you'd be feeling. On the other end, I've got one sort of process here which is sticking out and the other side doesn't have it. Now this represents the medial side of this bone. So I know I'm looking at the front because I've got this bulge on the front here which doesn't appear on the back. It's more of a dip or a groove on the back. And this is on the medial side. So bulge is on the front and this is medial. This must be your right tibia. Now this is a fibula. Now fibula, sort of easy to spot in some ways, but one of the hardest bones to distinguish your right from left. So your fibula contains one end here, which is quite bulbous. You can see this little sort of flick up. That's a really important little spike there to remember. On the other end, you see it's kind of flattish on one side, but if you look at the other side, it really cuts away. So that helps us distinguish front and back and left and right. We use this point here to determine front and back. That point there is at the back. This is the front, this is the back. So I'm looking side on. This would be the front, this would be the back. Now on this end, this smoother part is on the outside and this groove is cut away on the inside. So it would be positioned like this. I'm looking at the front now. I know it's the front because this groove, this spike is on the back. And it cuts away on the inside and sort of flares out flatter on the outside. So I'm looking at the front of my right fibula. Now the foot contains tarsals, metatarsals and phalanges. There's 7 tarsals in total, so all these short bones that you see here represent the 7 tarsal bones. 5 metatarsals going from medial to lateral, labelled metatarsal 1, 2, 3, 4, 5. And then we've got our phalanges, all of these little bones, phalange, 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 right through proximal, middle, and distal. So in anatomy, we use a lot of different terminology, and that is often one of the hardest parts in this type of subject. Different words that you may not have used before. So in this next activity, we're going to be doing some directional terms. I want you to have a go, see what you know already in your book, and try and match that word with where it might fit, based just on common sense at this point. So now you've had a go at this directional terminology. Let's have a go through some answers and put it in a little bit of context. So the word for above is superior. So think about this as like, say you're superior, they're above you. And the word for below is inferior. So meaning beneath or below. Put it in an anatomy context, you might say that your eyes are superior to your nose, or your chin is inferior to your nose. And we can use that terminology right down the body. Now, anterior, posterior can't really be seen on this picture because anterior means closer to the front surface of the body and posterior means closest to the back surface of the body. So putting in a context, you might say that your nose is anterior to your ears. It means it's closer to the front surface of the body. Your chest is anterior to your back. Posterior, we can use the exact same thing but in reverse. You could say that your shoulder blades are posterior to your sternum. That means they're closer to the back surface of the body. Now, when we use the words proximal and distal, we refer these mainly to the limbs, right? So proximal means closer to the point of attachment or the trunk, and distal means further from the point of attachment or the trunk. So proximal to distal. Give an example how these might be used. You might say that the hand is distal to the elbow, or you might say that the elbow is proximal to the hand. They can be used in either context, just depending on which one you're referring it to. Then we've got medial and lateral. Medial meaning closer to the medial plane or center line of the body. So we see the medial line straight down the middle. Anything closer to that is medial, anything further from that is lateral. So we might say that the belly button is medial to the nipple. You might also say that the ears are lateral to the nose. The ones remaining are superficial and deep. Superficial meaning it's closest to the surface of the body, and deep meaning it's further from the surface of the body. The way we might use this is we might say the skin is superficial to the bone or the muscle. We might say that the hair is superficial to the skin. It's further from the surface of the body. And we can say the same in reverse as we go deep. So have a go at completing the 5 sentences below and let's see what answers that you come up with. As we go through these answers, you could say that the head is superior to the chest. You'd say the ears would be lateral to the nose. The hair is superficial to the skin. The wrist would be distal to the elbow, and the elbow would be proximal to the wrist. So in these last 2 examples where it talks about the wrist and elbow, you could say that the wrist is inferior to the elbow and the elbow is superior to the wrist. However, in the limbs, we don't tend to talk about this using superior and inferior. We tend to use the terms proximal and distal. That way, when you move the limbs around, the answers remain the same. So for example, if I was standing with my hand in the air, it's still proximal and distal, same answer, but if I was using inferior and superior, that would switch around. So there's 3 planes of motions. Now, see what you can remember from your lecture, but I want you to have a go at writing down what you think these 3 planes of motions are. So the sagittal plane. The sagittal plane is what is used when we divide the body into right and left sides. So if we were to put like a plane of glass straight through us, dividing ourselves into right and left sides, this would be called the sagittal plane. The one labelled over here is the coronal or frontal plane. Both names are correct and used interchangeably. This describes dividing the body into anterior and posterior portions. The final label we've got down here is the transverse plane. Transverse plane is used to divide the body into superior and inferior portions. Now, they don't always have to be even. Say, take for example the sagittal plane. If I slice straight between my eyes, that's a sagittal plane. But if I just chopped an ear off too, that's also a sagittal plane cut. Right? So anything in this line is sagittal. Same with the others. So if I divide myself cleanly in half, that would be an even split for the transverse plane. But anything dividing, like I just chopped my head off, that's also a transverse plane cut also. But where all of these are evenly divided, the same on both sides, that is where you find your center of gravity. So when you're looking at these three planes, not only do we talk them in a definition dividing to right and left and so on, but we can talk about sports or movements that occur in these planes. And sometimes this is more difficult for people to grasp. So if I was going to do something in the sagittal plane, it might include like walking or running. That means that I'm moving towards that plane of direction. So I'd never cross that line that's divided me in half. Right? I'm moving in the same direction as that plane. So things like walking, running, even if I do a forward somersault, that would occur in the sagittal plane. Something like the frontal coronal plane, things like star jump and cartwheels, that means I'm moving in line with that actual plane of motion. And transverse plane, we see things that like have a lot of rotation in them, things that are moving along that flat surface. So even if I just stand here and swing my arms like this, that's me moving in the transverse plane. So things like hula hooping would be predominantly occurring in that transverse plane. Now we do acknowledge here that it is often the case that things don't fall really neatly, perfectly into one plane. Sometimes they cross between planes, or there's different diagonals or different angles going on. But simplicity purposes, we just try and divide it as best into one of these three planes. So we'll say the movement occurs predominantly in that plane. So in this next activity, you've got some space there where you've been asked to draw a cross-section of each of these planes. Now, we're going to give you a chance to do this in a moment, but think about this, you're drawing the cross-section. So I'll give you an example of the wrong. Drawing a cross-section of the sagittal plane would not be just dividing the body and drawing half a body with nothing on the other side. That's not drawing a cross-section. Drawing a cross-section would be if I divided my body into right and left, a sagittal cut, and then I looked at what I would actually see if I drew that cross-section. So you have to imagine rotating your body around to what you might be looking at if you're drawing the cross-section of this actual plane. So see if you understand. I'll give you a moment to have a go at that, and we'll come back and have a look at what some answers might be. So when you draw a cross-section of each of these three planes, what you would see when you look at the sagittal is something like this. You'd see like the side of a person, see his feet down there. This person's a little bit skinny, got a lollipop head. But you would see the side of the person, their nose would be out here. We're not looking for any detail when we do this, just a silhouette. When we see the frontal or coronal plane, we would see essentially a gingerbread man type looking like a person, someone essentially standing there looking fairly normal. Because if you divided someone into anterior, posterior, and you looked at the cross section, you would essentially see the same outline of the body. Now, if you divide the transverse and you look at the cross section, you would literally see something just like a circle. Depending on where you cut it, you might see the wrists. If you're looking down, you might even see the feet out the bottom. So that's a cross section of a transverse plane and looking straight down. So next we're going to look at some movement terminologies. Now in the lecture we went through what a number of these were. I want you to have a go at putting the correct word next to the correct definition before we go any further, and let's see how you go in getting the ones right. And there might be a couple of little tricks in there or things you haven't seen, but we'll see how we go. So when we decrease a joint angle, it's called flexion, and when we increase a joint angle, it's called extension. Some of these are obvious to see and some less obvious. take an example of flexion of the elbow, would be flexing the elbow. So the angle here is decreasing. If I extend the elbow, I would do this. That would be elbow extension. Same with the fingers. I flex the fingers, I extend the fingers, I flex the wrist, I extend the wrist. Some of them are more difficult to see, like the shoulder, for example. Being a ball and socket joint, it's hard to know where flexion is. Like, is that decreasing? Where's the angle increasing and decreasing from? So if I'm in the anatomical position and I move my shoulder forward like this is flexion of the shoulder. And if I lower it down, that's extension of the shoulder. Right? And that occurs right up until I cross the medial plane of the body. So I flex, 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 and once I go behind my head, that becomes hyperflexion. When I come down, extension, 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 I go behind my body, it becomes hyperextension. So flexion of the hip is the same angle as the shoulder. So hip flexion would be forward like this, and hip extension would be back like this. Behind the body again, hyperextension. The knee looks a little bit different because we're coming from a different plane now. So flexion of the knee would be like this, the decrease in joint angle, and extension of the knee increases back to neutral. So when we talk about movement towards and away from the trunk axis, we use the terms abduction and adduction. So the word abduction means to take away from the body. So if I abduct the shoulder, it looks like that. That's shoulder abduction, right? Some people think of this like, you know, you've abducted something, you've taken it away. If I adduct, it comes closer to the surface of the body. So adduct, I add to the body. So this would be shoulder adduction. So abduction, adduction. In the hip, it would be abduction, adduction. So turning the palms up would be referred to as supination, and turning the palm down would be referred to as pronation. This can be remembered because when I turn the palm up, it's like holding a bowl of soup in the hands, so supination. Turning the palm down, it's called pronation. Some people remember this by like a pro basketballer dribbles. Right? When we say pointing the toes down or pointing the toes up, what we're really talking about here is it's an ankle movement, but we use the toes to help describe this. So when my ankle is put in a position where I'm pointing my toes, that's called plantar flexion. So if I stood on my tippy toes, that's an example of plantar flexion of both of my ankles. Some people remember this by, like, if you plant the accelerator of a car, you're pointing your ankle into plantar flexion. Dorsiflexion is the opposite. So if I'm pointing my toes up, right? So if I, like, say, kick a door down, that would be my foot in dorsiflexion. Then there's some specific ones that only occur in certain parts of the body, like elevation and depression. So a great example of this is my shoulder girdles. If I raise them up, I elevate. If I bring them down, I depress. So just think about when I go up, elevate, like an elevator goes up. Doesn't really work because the elevators also go down. But we think about going down as depression. If someone has depression, they feel down. So up, like this, would be elevation. Down would be depression. Now, inversion and eversion refer to movements at the feet. Now, this occurs in the joints of the feet, all of them working together to form what we call inversion and eversion. So when I place weight on the outer edge of my feet, that means like I'm rolling my feet out, that's called inversion. Now, a way to remember this is by saying during inversion, the soles face in. Now, if I place weight on the inside of my feet, that's called eversion. So in eversion, the soles face out. Already referred to before with the flexion and extension. Now we're talking about that in regards to hyperflexion and extension. So where it says I'll move my arms anteriorly past vertical. So if I'm moving my arms anteriorly, this is an example of flexion. But once I pass vertical, that becomes hyperflexion. If I move my arms posteriorly, so this is extension, and then I move past, I become hyperextension. We can see these examples in something like, you know, the neck or the trunk as well. If I tilted my head forward, that's flexion. I lifted my head up to neutral, that's extension, but as soon as I go behind, it becomes hyperextension of the neck. Same occurs in the trunk, flexion, extension. If I lean back behind, that's hyperextension. Now we've got circumduction. Now, when we refer to circumduction, it's actually not a movement on its own. It's a combination of flexion, extension, and abduction and adduction all rolled together. Some great examples of where circumduction occur are the shoulder and hip. So when I roll my arm around like this, that's circumduction. It's combining all these other elements around. It's not a movement on its own. Same with the hip. When I roll my hip around, that's circumduction. So at the completion of this first tutorial, there's a couple of things that we're really focusing on, trying to remember and trying to learn. Firstly, we need to know what our three planes are. We need to know our three planes of motion: sagittal, frontal, and transverse. We know the definitions and what movements occur in each of these. We need to use our movement terms now. We can't use above and below and that stuff. We need to be concentrating on using things like superior and inferior and using those movement terms throughout. We also need to learn our directional terms, our movement terms, so the flexion and the extension, abduction, adduction, knowledge of what all those terms mean. Now, probably the toughest part of this tutorial is the bones. Now, the bones are going to take some days to learn all those rights from less and knowing what all those lumps and bumps mean, and eventually we're going to give actual meaning to those and what actual each one represents and is named. But for now, what I want you to focus on is learning the bones and what they look like individually. So you should be able to put any bone in front and know what it is, just singularly. Someone put a bone out and say, what's this? You know exactly what it is. And learning front and back and left and right. It may take a few weeks to get, but that's what we're really focused on now. So each bone, what it's called individually, and then learning what the front and back is and the left and right is. Now in the coming weeks, we're going to then develop what the specific names for each of those little lumps and bumps actually is.